I'm Dr. Janowitz from Synergy Avito Chiropractic. I have the privilege of taking care of my buddy here, Jay. High five. All right, so Jay's been a patient of mine for a while, and a lot of people are like, wow, do kids come and get chiropractic? Well, this kid has. He's been a patient of mine since 2010, so almost 9 years. So I've seen this guy grow up. And today, though, he's got some neck issues. So you said you can turn to the left, so turn your head to the left.
Yeah, the entire.
Good. And then turn to the right side.
To the right, it's a little.
Tender when you go to the right side.
Yeah, I can look, but it starts to get worse.
Your eyes can look, but your head can't, okay?
Oh, yeah.
So we're going to assess him, okay? So obviously there's a misalignment pattern there. And so let's check here. So when we feel, so this is called palpation, which is when we feel the areas, and we're going to see what's actually causing that pattern. So he's pretty much locked in his upper cervical spine at C2, so there's pressure way up in here. You feel that, guy?
Oh yeah, that's where it is.
Okay, that's the pressure. So C2 on that right side. So we're going to work on that. And then he's got some associated trapezius tenderness right here, even on that right side right there as well. So we're going to work on releasing that. So let's go ahead and have you lie face down for me, bud.
All right. Well,
there you go. There you go. Wherever you want to, I'll take it from you, bud.
Thank you.
Okay, and so first thing is we're gonna start from the bottom here, work our way up. So when we look, we're gonna look at leg lengths, okay, which are pretty balanced. The right side's a little short there though, and we always like to check sacrum. Raise your right leg, good, and down. Raise your left leg, good. Okay, good. Those feel pretty good. Even though he's got an upper back issue, the spine's connected, so we gotta work on the spine because it's a unit. Good. Now his mom is a teacher, so she can appreciate teaching, I'm sure. And so we're going to work right here, use the arthrostim. So when we work on a patient, we're feeling the spine. And so this is a lower force technique that does very good, and it doesn't require a lot of twisting or jolting right now. And so we don't have to do that type of maneuver. So there are maneuvers that we're going to do with him that are a little bit more what's called a high velocity, low amplitude movement. So we're going to come here in his mid back. We're going to palpate here. Good. You're going to take a breath in and let it go all the way. Perfect. So that was great.
Yes.
Good. Now he had that tenderness in his trapezius muscle, so we're going to work on that. That was on the right side. Use what's called the Activator. So it's a spring-loaded instrument. And work on that tissue here. Good. A little tender there, bud.
Yep.
You'll go through it. Good. And then go ahead and turn over for me, please, on your back. Mm-hmm. All right, brother. Okay. I can't believe it's been 9 years that I've been working on you. That's amazing. Okay. Mm-hmm. So we found here that C2. So we're going to work here. So we're going to come here. This is going to come like this. It's going to come.
Ow.
I know. Let it come through. Wiggle your right big toe. No, a little more depth. There it was. Good. We're going to come here. Let this go. Perfect. Take a breath in and out. Good again, breath in and out. Good. Just work a little bit on that tissue there, bud. Good. And then we're going to have you come on up and be seated again right where you were the first time. So you're going to be here. Good. I'm going to come behind you.
Okay.
All right. Okay, so we're going to just recheck right here.
Mm-hmm.
So this part right here, we're going to work through here again. Good. Perfect. All right, so now let's just see here. So turning to the left was okay. Turn to the left again. Just want to check. Good.
Yeah, that's much better.
Good. And then turn to the right. Though that was the hard part. And look how easy he moved that way. So there, it didn't stick there. Does it feel looser?
Much looser, yeah.
Okay, so that's how we can do an adjustment. So it doesn't require a lot of force. We work a lot with kids because obviously they're active. They do a lot of things, and now with devices, reading, cell phones, and everything, so that puts a lot of neck flexion. It can cause these issues. But if we can clear them out when they're early, then we don't have to deal with compensations as you progress in life. So we can attack the problems right when they occur. He comes in, we get this knocked out. It doesn't become any chronic issue for him. So thanks, buddy. You did great, Jay. Appreciate it, man. Awesome. You rock.
Yes.
Okay. Good. Better.